This is Jen and Nikina on eyesurgeontalks, and in this video I wanted to talk about the different gases that we use inside the eye when we do retinal surgery. So we very frequently use a special gas bubble at the end of the operation that we fill the eye with when we do retinal procedures. We do this for retinal detachment operations, we do this for operations for macular holes. Why do we actually use gas, and what do the different gases do? Well, I like to think of it by analogy to gluing something together. If, for example, your retina is detached from the wall of the eye, we need to put it back together, and then we need to glue it in place. When you're gluing something, you need to put the glue there, and then you need to hold the two things together so that they have time to stick and the glue has time to set. And it's very much the same in a retinal detachment procedure. So during the operation, using a series of steps, we'll attach the retina back to the wall of the eye. We'll glue it in place using either freezing treatment or laser treatment, which causes some inflammation and a scar reaction. And that scar takes a few days to develop. So while that's developing, you need to make sure the retina stays up against the wall of the eye. And that is what the gas bubble does. Now, it's important to say that the gas bubble doesn't push. It's not an active process. We don't put the gas in at pressure, because if you put the gas in at high pressure inside the eye, that will be damaging to the eye and it won't be very good for it. So we put the gas into the eye at normal pressure. But what it does is essentially, in a retinal detachment, the reason the retina falls off is because there's a little break, a little hole in the retina. And we need to try and seal this hole. And while the retina is sticking down to the wall of the eye, the gas bubble keeps that area dry. It stops the fluid from inside the eye coming in through the hole and detaching the retina again. So that is the purpose of the gas bubble. And the reason we use different gas bubbles is because of the position of the damage in the retina. So for example, if the break in the retina, the hole is up near the top, we don't need a very long acting gas bubble. We only need the gas bubble to be there for maybe days or a couple of weeks while that part of the retina sticks, because we're walking around upright and the gas bubble will float to the top and it will happily support that area of the retina for as long as we need it to. If the hole in the retina, the damage in the retina is at the bottom, however, we can't hang people upside down. And the gas bubble will float to the top, and it means it won't support that lower bit of the retina for very long at all. And that's why we use longer acting gas bubbles, ones that disappear much more slowly from inside the eye and hang around for longer, because they will support the lower parts of the retina for longer. And also, this is the reason why we ask patients to posture, which means keeping their head in a particular position. That's in order to allow the gas bubble to position itself up against the correct bit of the retina that we need to support. That's retinal detachments. And so you might find yourself with, there's three commonly used gas bubbles, something called SF6, C2F6, and C3F8. And they have increasing times that they take to disappear from inside the eye. They last a different length of time. In terms of macular hole surgery, we use gas bubbles here as well. And here, of course, we don't have to stick the retina back, but the gas bubble, again, prevents the fluid from coming through the macular hole, encourages it to close. But also we think that the sort of the meniscus effect, the surface tension of the gas bubble, encourages the edges of the retina to come together and to close the macular hole. That's the thinking. But in truth, we don't know for sure how gas bubbles work here. There's lots of different possible mechanisms that I've mentioned, and some other ideas as well. If you have a gas bubble in the eye, it's important to remember that you won't be able to see through it, which is completely normal. Things will be very blurry. That's because we can't focus through gas. And also you can't travel to altitude. So high mountain travel or flying in an airplane, as well as diving underwater, especially things like scuba diving, where you have big changes in pressure. because that can affect the size of the gas bubble and cause serious problems for the eye.